allow me to invite Dr. Mercy Mwangangi, who is the CEO for SHA, to make some welcoming and opening remarks. Tumkaribishe kwa makofi tafadhali. Dr. Mwangangi, karibu.
Thank you. Your Excellency, the President of the Republic of Kenya, Minister of Health, Honorable Aden Duale, Cabinet Secretaries present, Governors present, Principal Secretaries, IG, Ambassadors present, Members of Parliament, all dignitaries, guests, good afternoon. Your Excellency, only 9% of the African continent has access to emergency care services. Your Excellency, that means 9% of 1.5 billion Africans have access to emergency medical care services. And Your Excellency, the reason to this is because historically, African health systems have focused on treating communicable diseases, but the tide has changed, Your Excellency. We are now faced with a double burden of disease, communicable and non-communicable diseases, and most emergencies fall under both classifications. Your Excellency, today Kenya serves as a model for Africa. This will be the second dispatch center, Your Excellency, and this has only been made possible through your administration and through the investments that your government has put in emergency medical services. Your Excellency, Kenya should be proud. You should be proud. We are rolling out the universal access to emergency medical services. Your Excellency, as I conclude, SHA, together under the guidance and stewardship of the Ministry of Health, will now focus on 4 key pillars that will ensure these EMS services are sustainable. The first one is governance. We've been able to set in place governance mechanisms. As you've seen, ambulances are checked. We ensure that these ambulances are safe and they'll be able to do what they need to do to rescue Kenyans. The second one, Your Excellency, is financing. Your Excellency, your government has provided adequate budget to be able to actually conduct and pay for the dispatches, as well as pay for the first 24 hours of care. Your Excellency, the third pillar is training. As you saw, we are setting up a worldwide emergency training center, and EMTs will be able to receive training services there. The last one, Your Excellency, is communication and data-driven decision-making. From the center you've seen, we will be able to make decisions on when a dispatch is due, the number of life-threatening conditions we have in the country, the number of ambulances we need, the budget requirements that we require. Your Excellency, as I conclude, I want to conclude with a sad story. On the 8th of March this year, Your Excellency, you and I actually spoke at around 7 p.m. And when we were speaking, I told you I had just left a first responder accident in Kisumu. A matatu, a tuk-tuk, 4 dead, 15 casualties. I went in there as a doctor because I was on the road. When we were there trying to take care of those casualties, there's a lady who was in a pink dress and her leg was broken, but unfortunately her rib had pierced her lung. And so I could tell as a doctor that she has what we call pneumothorax. Your Excellency, as the CEO of SHA, I did not know what number to call. All I knew to do was to prevent the bleeding and try and stabilize the lady in the pink dress. Unfortunately, on Monday, when I went back to the office and reached out to Dr. Ganda in Kisumu, he informed me the lady in the pink dress had died. Your Excellency, what you're doing today is monumental. It is a milestone. You should be proud. Kenyans should be proud. We now have started the journey on ensuring we all have access to emergency medical services. And Your Excellency, unfortunately, the lucky ones in this room will die in their sleep. Those are the lucky ones. The unlucky ones are more of us. We will die through an emergency. And so we have to invest in emergency medical services to ensure that lives can be saved. Thank you, Your Excellency.
Thank you, Dr. Mercy. Next, Your Excellency, allow me to invite the Governor of Nairobi County, who will speak briefly and also represent the other governors present. Tumpigie makofi tafadhali akija. Karibu, Governor.
Thank you very much, Mike. Your Excellency, Dr. William Samoei Ruto, President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, Cabinet Secretary, Aden Duale, fellow governors, members of parliament, distinguished guests. I'm told there's a whole mix of different stakeholders. I'd just like to take this opportunity to welcome you to Nairobi. Karibuni sana. It's my honor, Your Excellency, to join you today for the launch of the National Ambulance Dispatch Center. It's a landmark milestone in Kenya's journey towards a faster, smarter, and more integrated emergency medical system. Your Excellency, allow me to begin by congratulating you for your bold leadership in transforming healthcare in our country. This is just one more thing that you've done. From the establishment of the Social Health Authority, to strengthening primary health care, to championing emergency medical services and making every woman everywhere, every newborn everywhere, a national priority, your administration has demonstrated that healthcare is not merely a social service, it is a national investment in Kenya's future. Nairobi County is proud to work with you in this journey. As a capital city, we bear a special responsibility. Every day our hospitals in Nairobi serve not only the people of Nairobi, but thousands of Kenyans referred from neighboring counties and from across the country. The strength of our emergency response system, therefore, has implications beyond the borders of Nairobi. That is why we made it deliberate to invest heavily in emergency medical services. Long before today's launch, Your Excellency, Nairobi established our Nairobi Emergency Operations Center